about Oxford. Anyways, middle. Okay. Okay. There are so many tips in Japan. So the first one is bearing dislocation. This is more frequent in Asian countries than Western countries. Maybe due to the size of their body frame. Because a bigger bearing is more difficult to dislocate. Because entropy, or in other words, jumping height is higher in the bigger bearing. The big bearing means the big femur component size. This is the one reason because why in Asian countries dislocation is more prevalent. So what is the best interoperable implementation? So that is just feeling. Feeling is very important. The feeling is different among the surgeon to surgeons. So the ideal situation is if we insert size X feeler gauge, very smooth, very loose. Oh, it's too loose. I'm afraid of dislocation. But one size increase feeler gauge, such as P3 is loose, but 4 is very tight. It's the ideal situation. So at this situation, we always choose thinner bearing, thinner feeler gauge size. So never use the thicker one. At the beginning, because they always worry about dislocation, they tend to select the thicker one. But that feeling is very nice because so too tight means entrap the bearing tightly. So they think it's difficult to dislocate. But in fact, if we insert the thicker bearing, surrounding soft tissue such as MCL and other ligaments can stretch, then cause chronic damage, damage of the surrounding soft tissue that can cause secondary looseness, secondary damage of MCL that can cause loose, enlarge or gap. Eventually, that cause dislocation. So never to lose. So if you worry about which is the better, thicker one or thinner one, I always recommend to select that thinner one. Okay. But this is in the male patient, the evaluation is relatively easy than the female patient because male patient has so the tissue is not so elastic than female patient. Female patient has very elastic, so it is quite difficult to distinguish, decide it is tight or not. So we stretch, and the females, so the tissue can stretch, especially in the elderly small frame females. So in terms of the evaluation of soft tissue and gap, the male patient is easier to evaluate. So before the surgery, I recommend to feel the end point of MCL. So in 20 degrees inflection, apply the valgus stress. Then you can feel, sorry, the end point of the MCL like this. This bearing is very important. So in manual or some interruption, apply to valgus stress. But in fact, never distract the media side. Apply the burger stress. Just restore the the native MCL tension and length. That's all. So just like the evaluation of ACL, applied onto drawer or Lackman, you can see the endpoint. But you never stretch more than the endpoint. So that's safe. Of course, elasticity is more elastic in MCL than in ACL. So you can, after the come to the endpoint, then you apply the vagal stress more. The media side will open more. Yeah. But never, the endpoint is very important. Other time, never extend fully. Slightly flex, then posterior cups can relax as a situation apply the vagal stress. And what is the expression gap? Two finger is essential. So, leg weight extend the gap. But flexion angle should be 10 degree, 100 degree, or 110 degrees. Accurately saying, it should be 109 degrees because femur component implanting in 10 degrees inflection and tibia component implanting in 7 degrees posterior slope. So evaluating the friction gap, the tibial cutting surface, in other words, tibia tray surface should be parallel to the peg hole because we read the shape, the design of the femur, the parallel perpendicular to the peg hole using the mirror. So if cutting surface and peg hole is not parallel to each other, if flexion more, if leave the distal end, the flexion gap can be shortened. Yes. On the other hand, if the flexion angle is not sufficient, it will leave more. The flexion gap can enlarge. You understand? Okay. で、掘る方向と、この方向と一緒やないと、ギャップ変わってくる。Pig hole. Pig hole, so pig hole should be parallel to the cutting surface. In this situation, so pressure gap never change. So exchange gap doesn't matter. But but it is quite difficult to identify the peg hole direction and cutting surface to be parallel. Anyway, so 10, in fact, 107 degrees inflection. It's very important to peg hole and cutting surface should be parallel to each other. That's very important. So mild valgus is allowed. So that means, so in this hanging position, never extend the medial gap. In some cases, but my feeling is the most case in this hanging position, so medial gap can be shortened. Maybe due to the maybe ACL should be the pivot point, and then leg come to a slightly valgus. Maybe so. Valgus means the open the medial side to MCL to be natural. Okay? So gently hold the heel and lift up gently to the lateral side. Then MCL can reduce its original length and tension. And keeping this if I lift up the heel more, so femur can rotate. So without stress, apply the stress. If you apply the push the lateral side of the knee and lift up the heel, the it can provide the vagus stress. That means MCL can stretch than its original length. So just restore its original length. It's very important. So gently lift up. It doesn't matter. After to MCL to be its natural length, then keeping this length, the femur can rotate it, keeping its proper length. But if you apply the vagus stress and push the heel to lateral, that can stretch the MCL. So stress or lift up and reduce the medial MCL length and flexion angle is very important. So it's very important to feel normal tension and length of the MCL. It's very important. Never stretch, but it's sometimes shortened. It is a pitfall. Extend back is also difficult. So because it requires a vagus stress to compensate the leg weight in a flexion. So leg can stretch, leg weight can stretch the medial depth. But in extension, we should apply the vagus stress. But in the same, okay, that must not be the stress. Just restore its original tension and length and MCL. Just restore to be natural. Just restore the MCL to be natural. So this feeling is similar to the preoperative vagus stress. Intraoperatively, you can feel the endpoint. So you should restore the same feeling in the same position before the operation. So feel the MCL tension length by your hand. So you should remember the feeling of the preoperative endpoint. But in this position, we need 3 hands. One, we should grab the ankle and push the knee from the lateral side and the manipulate the pyramids with these 3 hands. So maybe assistant. So assistant hand is one of them. So it's up to you. So, or I sometimes grab an ankle under my shoulder and apply and feel. Oh, that's another feeling. But normally, to ask you the assistant, please hold the ankle and push insert feel like this. Or ask the assistant, please push the knee from the lateral side and insert. Or I hold the leg and please check it. So it's better to check by the operator and assistant. It will better to share our feeling. So like this. This is I hold the assistant holds the lateral, push the lateral side of the knee. I hold the ankle and manipulate the feeler gauge in this situation. Okay. Anyway, so job evaluation is very important. So when I submit some paper, so how the reviewer asked me, how do you evaluate the gap? Do you feel mm, some kind of tensor devices? No, I use a fear. Oh, it's a very not uh, not so reliable. No, it's not a reproducible, but I insist that for the more than 40 or 50 years. So this evaluation is made used by the many surgeons, and we get the good long-term results. So we believe it is the best way to evaluate the field radiation. はい。ということで。まあ、これなかなかいつも議論になる。あんまり信用できへんのちゃうんかって、レビューは言うてくるんだけど、多分、フィックスに言うたら言うてくる。まあでも長年これでずっとやってて成績がいいからっていう。フィックスの主義。やるのはやんねんけども、フィックスの場合はちょっと変わってて、1ミリか2ミリぐらい余裕を持たせるって言われる。もうそれは絶対外れない。いやいや、外れないし、あんまりきつかったらそこで、ポリの摩耗が起こるから。だから、ここはもうぴったりと屈曲進展合わせるいうことで、ものすごくはっきりしてんだけども、モバイルの場合。So we are talking about the mobile variant, just adjust the pressure and the extension of that road. But in terms of fixed bearing, the gap is not too tight, but a slightly loose. Apply the bag space, the 1 or 2 millimeter of space is required for the fixed bearing to prevent the wear of the polyethylene. And in the same time, we should take into account the total legal line. Most fixed user is want to restore the legal line, total legal line to be slightly balanced. So a slightly liquid line pass a slightly medium to the center. So for the fixed bearing, they should control the gap and alignment in the same time. I believe it is quite difficult. But for the mobile bearing, legal alignment doesn't matter. So we should take care of only about the gap.